Hello, members, and welcome to another AAIP IDS webinar. Today, I wanted to go over the website again that we have, the IDS Library, because in doing the evaluations that I'm doing weekly with our members, I'm finding a lot of the help that you need is right here in the library. So what I wanted to go over is using it and using it based upon the problems that you're currently facing in your practice. Again, I wanted to remind you of a few different services that we offer to you as a member. One is where you and or your team or a team member can come to our office and spend the day with us. And with this, your team can discover for themselves that what you're talking about, what you want to do, and what we're doing actually does work. They will see how we do new patient phone calls. They will see how we do block scheduling. They'll see how we manage the flow of the schedule, the flow of the staff. They'll see how we do the new patient regimen. They'll see how we keep the patient inflow and outflow going effectively and efficiently, how we set up for surgeries efficiently, how we flip over rooms efficiently, the end of the day duties, the opening duties. They can see all of this, all the stuff that you keep saying to them, listen, this is what we need to do. And they say things like, well, that's not going to work in this office or this area. It does. It works for all of them. So they can see it. We are a working, successful perinatal office, and once your girls see that we do the same work that they do and it's possible here, they'll start to believe that it can happen in your office as well. I can also come to your office. This is something I do quite often, where I can come to your office for one day. I can observe everything that you do, the phone answering, the clinical setting up, preparing for surgeries, the inflow, outflow, the case acceptance, flows of the appointments. And then the next day I can lecture on what systems would work for your office, what would be best for you to implement with your team to give you the success that you're working on. And for those, I'll gather, first of all, what are your goals? I'll gather from you and your entire staff, what are the barriers, problems, and it's a customized day of, okay, this is what I see, this is what you guys could use, and I will teach that in with your group. That I'll follow up, of course, with about 6 months of follow-ups with the manager or yourself so that we can make sure those systems stay in. You guys can hire us for a year. Hire us for a year, for every single week, for an entire year that we implement systems. We teach structures. We deal with your struggles and barriers and problems with you, for you, to make sure that you can achieve big goals or big happenings or big curves that you want to do. And then there's simply doing what you're doing now. That's being a member. And with the member, you do have this. You have the library. So once a month, I'm sending out evaluations and based upon what's going on, and I will suggest to you what I think would work. Maybe it's an answer, maybe it's one of our additional services, or it's the library. So let me show you the library here. So going back to the library, when you go to directorofdentistry.com, it will pull you up to the site, which looks just like this. Actually, when you go to the site, it looks like the base page here. This is what you see here. So all you need to do is go up to where it says membership only content. And it will give you this entire library here. So based upon what's going on, maybe you just want something really quick. You want to think of some good ideas that can be implemented in one day. Just go to Monday Morning Minutes and you'll see on here all the ones that Dr. Sheldon has done and all the ones that I have done. Right here. Anything from completing the cycles of actions to not allowing the patients to wait, encouraging ideas, end-of-year reviews, financial meets, ethics worksheets, follow-up calls, our implant warranty, incentive programs, just all kinds of things that you can think of. Quick, less than 5 minutes each one of these. And just listening to a handful of these, maybe even on your way to work, would be sometimes exactly what you need just to get something going. The phone modules we went over last week. So with the phone modules and with any of these modules, when you click on them, you'll see the very, very first thing that says read first on every single one of these. When you go on to it, it will give you the check sheet of how I want you to do this particular section to do it correctly. So last week we went over all of these on what your staff can do if they're training on phone answering, or they need to train on phone answering, or they need just some sharpening skills on phone answering, just give them this worksheet and have them work their way through. Today I wanted to go over something different. So for these, and I'm going off the evaluation sheets from what I sent out at the beginning of the month on what actually happens to be the things that are bothering these offices right now. The treatment presentations you're going to find are mostly direct, they're for doctors mostly, and they're just different presentations that have been put on by other specialists, other big people in the periodontal world to show you different techniques or different types of things they do. The marketing, to do a lot of this marketing external, goes over the implant lecture. So if you're interested in doing the implant lecture, if you're interested in doing some social media marketing, if you're interested in doing the ACE chat for your website, doing some writings, which is probably the first thing that you should do, so you put together pamphlets or books. The magazine that we do, that's on here as well. It's a lot on the magazine, as well as Google reviews. So that's a big one that everybody's kind of going through right now. So it's doing the Google reviews, obtaining the Google reviews, how to do them with your staff so they actually ask and you actually get them. So we go over how we got our staff to do, and we have over 200 Google reviews now, and so we share that with you. It goes over direct mail marketing, and also your website. So clicking on the external marketing on this one will give you a lot of different ideas of things that we use to grow our periodontal practice to where it is now. The internal marketing, that's a lot for your staff. So again, on the Read First, going through here, we have an internal marketing webinar, which is the first thing that you should watch there. How to implement those internal marketing actions that we're talking about. The charitable giving campaign, which is a way that we started this, gosh, so long ago, and we've raised $100 and some odd thousand to local charities. Local charities are your best way to do this because they are locally thankful. So they will send people your way, they'll come your way, they'll mention you in your community, which is phenomenal. But basically for that, if a patient is being referred over by another office, you go to that office and you say, hey, Dr. Smith, we have a great relationship. You refer patients here. From now on, tell your patients that when they come over, the new patient examination is free. Everything is free as long as they donate a check to a local charity, and we'll give them a list of 7 to choose from. Patients love it. Doctors love it. Referrals love it. So it's a way that they can come in for a low cost, but yet go to a good cause. We have our the Google reviews as far as what the staff can do for the Google reviews. Different companies we've used for the Google reviews. We have our post-op, our final post-op check, which is the graduating ceremony for patients who have had treatment here, the before and after books, a lot of things that we do internally. We do have a care to share card that we have in here as well, where patients and staff can refer others to your office and earn incentives for doing that. So there's that one in there as well, which is a really good one if you're looking to up your referrals. The only thing we don't have in there is the general dentist referrals, because as you guys know, we go direct to patients for everything. So you can keep doing your referrals through your general dentist, which is what you're doing as far as your deliveries, the stuff that you do for them. Great, fine, don't quit doing that. These are just ways for you to also go out direct to patients off the street and say, hey, this is what we do, this is what we can do for you, and this is where we are. So that's what that internal marketing and external marketing is for. The differentiation for the director of dentistry. This has a lot of good stuff in here as far as what your staff can do to raise awareness to your patients about how great your practice is. So a lot of stuff in here is for you as well, how to find independence or how independence will find you. The differentiation strategies for patients and professionals, good lecture for you to show your staff. The what separates us. This is a form that we have created, and you'll see on here that is a piece of paper that you designed, and this will show you how to design it, where you can send it out to the public and they can see why come to your office. Because if you don't tell them and if you don't show them, they have no idea that you're any different than a guy down the street. They don't know what a periodontist is compared to a dentist. They don't know that you went to school 3 years longer. They don't know that you specialize in bone and gums. They don't know that you're just a better pick for it. They don't know that your staff is better, that you have a 3D CAT scan. They don't know that you'd use surgical guides or PRF or even what that means. They have no idea. So unless you put it together for them and educate them on what you have and why, then the only thing they're going to use to differentiate you and the guy down the street is how much you charge and how much less they are. That's it. So it's very, very important that you come up with that. So I would encourage you to do that. The dental implant warranty, why not? If you have a compliant patient that comes for their cleanings, that comes for their checkups, takes good care of their mouth, great oral hygiene, why wouldn't you give them an implant warranty? The implant is void for those who are not compliant. If they don't show up, they don't take care of their oral health, their bodies. If they don't do that, they void the warranty. So right now, you're already warrantying your compliant patients. You're not going to not redo the implant for them if something happens. It's the ones that are not compliant that you are like, no way. Still applies. But that's a great advertisement, great way to separate yourself. How to differentiate yourself from others. That goes in line with what separates us, to show people how you are different. Great different lectures here Dr. Sheldon has done on different things about healing, the opioid crisis, the World Workshop with Andra Ward, great webinars on here held by some pretty big people in the periodontal world. Stuff on the endoscopic. I know there's a big thing with laser versus endoscopy. This is a webinar on that. And also different things that other members have done with our programs to get some success in there. So my favorite, communication organization. I love it, love it, love it. Anything is possible when people are communicating, things are organized, and systems are in place. So you have that one. And you also have the case acceptance, which is a super good one as well. For the communication organization, on this one here, which I always recommend this one is the first one you should do. Create that groundwork for a happy environment, high tone environment, and then start working in your systems. So check sheets. Check sheets are absolutely wonderful, wonderful, and key to making sure that you avoid forgets, you complete your cycles of actions, and there's not any way errors can happen. So creating those check sheets for the front and back staff, demo check sheets let you know what we're talking about. The webinar on staff responsibility, what they're held responsible for, why, and how to do that. Great webinar. These are great things that you can show in staff meetings, great assignments you can just send them links to and have them say, yes, I watched it. Questions on what do you think? How can we do that? So on and so on. Hats. So those are manuals for how to set up for an extraction surgery, how to clean the units at the end of the week, how to clean the traps or whatever it is. It's a manual that you can hand somebody who's being trained or promoted or whatever in your office, so that you don't have to have someone standing there saying, okay, this, okay, that, okay, remember this, okay, let's do this again. You hand them the manual, much easier. A webinar on organization, written communication, and the org board. This is to assign responsibilities, show who does what, stop verbally interrupting and causing a stop in the flow, and doing most of your communication in writing and organizing your office so the flow is better. There's lean concepts in, there's less steps in place, so more work gets done and less socializing is done. Great webinar. I love that one. How to do an org board. Who does what in the office? Doesn't mean they do it. They're just responsible for it. They make sure it gets done. How to do written communication. It's just something new. People aren't used to it. It's so funny when we hire a new person in the office, they don't quite understand that. They come to you and ask you a million questions. So-and-so's on the phone. Who do I ask? I'm using the last of this. Can you let so-and-so know? Where do I find this? What is this? If you write it, if it's not something that is urgent with something that's needed right now, a patient, a situation, whatever it is, you don't have to verbally ask. You can write it down, and the person who it goes to can get to it when they have a free moment to actually handle it correctly. Demo staff meetings. We do our staff meetings once a week. Why? The longer you wait to handle problems or things not working, the bigger the problem gets. Every week, we face every single one of our barriers, every single one of our things that are not working, and the things that are working, we enhance on them every single week. Another lecture on the differentiation, great. And there's some things for office managers, which are great in here. Oh, these ones on the office managers are great for your office managers. So it's just different things that they deal with and how to handle those. The case acceptance, a great one, which ties into the phone answering. Of course, you want to do your read first check sheet on that one, and that way you can see exactly what to do. Of course, we said here you do want to do the phone calls first. They do tie in together. The 5 steps to case acceptance, how your assistant can increase your acceptance. These watching webinars are a wonderful flow to how every step will lead right to the patient being ready to accept because they feel comfortable, they trust you, and they're ready to go. It's a big library here with different things. Every single one of them. I can't tell you to skip one because they're all just amazing. Everything from the webinars, even the teleseminars are great ones on there. A lot of it talks about the same things, but it just really goes into detail on a lot of things. So I listened to them all back to back when I put this check sheet together, and I couldn't find one that I didn't want in there. Even though they were similar, they all said something in there that was either different or placed more focus on something individually. So it was really great. So that's a great one for someone who needs to improve their acceptance stat, someone who's starting to do financials, or somebody who has been doing them for a while and just wants to learn some new techniques. It's just wonderful. The block scheduling is one that I just absolutely love, and it's a really difficult concept to understand when you've never done it before. But for this one in particular, really it's just 2 steps on this one, 2 webinars. And it really just shows you the block scheduling seminar and my block scheduling samples. That's really it. So, but there's assignments on here of finding the production that you want, currently that you have, finding the current collection that you have, how many patients you're seeing now, and kind of going up from there. What do you want? How much production do you want per week? How much collection do you want per week? How many patients would you love to see per week? So it goes over kind of doing that analysis in your practice so that you can raise your stats and do more. It happened to us. We were seeing X amount of new patients per week, and we were just maximizing it. It was shoved and stuck in there, and we thought, there's no way we can see anymore. But we did find ways of shrinking those appointments, getting rid of stuff that really didn't matter, making them smaller, and picking days that it works better. And we actually worked in where we could see 3 to 4 more a week, and that increased our statistic immediately. So for you guys that are already members, you have your access code to get into the website. Get into that website and find some stuff to give your staff members. I encourage staff meetings to make this happen. Just do written communication to your staff members once a week. What do you feel like the problems are? What are some things you would like some help on? What are some things that you feel like you're having a difficult time, adjusting to or adapting to or working with? Ask them, find out what's going on. And then from there, you can assign them a webinar to watch or something to do. And of course, when I'm giving you those monthly evaluation forms, read them and fill them out, because I can assign to you which videos on there are really, really good ones for you to watch, and that will help with your problems. So you're not searching through and trying to find the ones that work. I hope this helps you. I hope that you can start using that library and watching the videos or watching the webinars, modules, things that will help you with the issues. And also look for that evaluation sheet every month and fill it out. Give it to your office manager to fill out if you're too busy. But use it, because I can start giving them things that they can do and make some improvements. Sometimes the smallest thing that you can change or implement can make the biggest differences. And then also don't forget about our additional services that we have, whether you're going to come here, I'm going to go there for a few days, or even we also have, and I didn't mention the packaged consult calls. You can get 4 consult calls for $1,200, and that way you or your office manager can make 4 1-hour calls to talk about something, how to implement something, how to take care of a problem. So I do recommend that you do that. Until the next webinar, have a great day. Thank you.